Some of the trans men that come to my practice have been on medications or on hormones, and others have not. So if they have been on the medication, it's important to taper off the androgens and then talk about the introduction of estrogens to reestablish ovulation, so the ability to release eggs again, because that will be part of the process of inducing ovulation and then pregnancy. What I find interesting is that the ovulation induction, so how we give medications, sometimes through injectables, sometimes through pills, to get the ovulation process going again, it restarts differentially depending on an individual. So that is sometimes what's not predictable. And I counsel the men that they need to be patient because it takes a variety of time. It can take up to 2 months to induce ovulation after the system has kind of been shut down for so many, sometimes years. This also becomes an emotional change because hormones change, and that also changes your perception of the world around you. And then also there is a risk when your hormones change that it may change your affect. So trans men are at risk of depression, not just in pregnancy, but also postpartum, when all of the hormones change quite dramatically. So those are kind of some of the issues that people need to be well versed with. Once the pregnancy begins, once fertilization has occurred and ovulation has occurred, the physiology of that pregnancy is akin to any other pregnancy. It's just a pregnancy. It is possible for trans men to chest feed because the physiologic changes of pregnancy stimulate the mammary glands in any same way as any other pregnancy. So the hormones that come from the placenta and the pregnancy will prepare the mammary glands for chest feeding. Another possibility for a trans couple wanting to build their family would be, for example, a trans man and a cis woman. So I would taper off the hormones for the trans man and then introduce the medications to grow eggs, extract the eggs and combine them with donor sperm, and create embryos. We then cryopreserve or freeze those embryos, and then we would prepare the cis woman's lining, so her uterus, with hormones, and then I would be able to transfer one of these warmed embryos into the uterus once the lining is ready, so that they can both participate in the family building process. The options for trans women are more limited, just because it is to freeze sperm, and then it is a much more complicated process, depending on how they plan their family building. So it is to know that you want to have a family later on. Before you transition, it's important to freeze sperm. And if you don't know, it is difficult to retroactively, after the hormones have happened, to change things back to free sperm. And that's because there's been long-standing exposure to estrogens. And therefore, I would encourage anyone who's transitioning or even considering to have a discussion about future family building. There is excitement. There is more excitement, I would say, than traditionally, because it's an option that we understand that maybe in our community wouldn't have been afforded us a decade ago.